Hey everybody out there in Facebook land. Hope y'all are having an awesome Monday. We are here at my office and enjoying this wonderful fall weather that blew in last night. And running just a few minutes behind, had a Monday morning emergency and we got that patient patched up and ready to go, looking good. And just did one of my favorite things, just placed a dental implant. That was a lot of fun. Looks great. Today, in honor of National Dental Hygiene Month, we are going to talk about oral hygiene. And for all y'all out there, if you have any questions, just write them in. That's the beauty of Facebook Live. I'll see them pop up on my phone and we'll address your questions live. I want to start by telling y'all about a few studies that were released in 2016 that are going to change dentistry and medicine forever. One was released by the American Heart Association, and the other one was released by the British Medical Journal. And what these two studies found was that oral hygiene and oral health is absolutely directly related to cardiovascular health. And having an unhealthy mouth is directly related to heart attacks and strokes. What we know is that more people suffer or die, more people die from heart attacks than anything else in America. It's the number one cause of death in America. And the number one cause of disability in America is the stroke. Okay? People spend more money treating heart attacks and strokes than they do treating any other ailment. So it's a big deal. Now, what these two studies told us is that inflammation in your mouth causes inflammation in your blood vessels. Now, we have 60,000 miles of blood vessels that go from the tip of our head to the tip of our toes. And that inflammation in our mouth goes through that 60,000 mile network of blood vessels. And what we know is that inflammation is the number one cause of destabilizing a plaque in your arteries. So you've probably all heard folks, cardiologists and physicians talking about blockages in people's heart and blockages in people's blood vessels that cause heart attacks and strokes. And they're right. But the way it typically works is that a blockage in a vessel is dislodged and it moves downstream where it causes a total blockage. And that results in a heart attack if the blockage is in your heart. But if the blockage is in your brain, that results in a stroke. So I want you to imagine for a minute that you have a big river. You're in the Mississippi River, let's say, and there's a little log jam. That log jam is impeding the water flow, but the river's blowing by just fine. And then one day, maybe a beaver jumps on the log or something, and that log breaks free, and it goes downstream, and it gets caught in a bend in the stream further on down. Now at that point, the log stretches all the way across the river and the water can't go across. That's the same type of thing that we're talking about with heart attacks and strokes. As that blockage in a bigger artery or vein moves downstream to a smaller spot in your circulation system, then it totally blocks things and causes a heart attack or a stroke. So we certainly want to encourage you to go to your dentist regularly and get checked out for periodontal disease, because that's what causes that inflammation that we're talking about. Gum disease or gingivitis or other terms for that. Okay? Make sure your dentist is taking a full set of x-rays every 5 years. Make sure your hygienist is probing your gums to check on your gum health. And those are the things that you can do to help reduce the inflammation in your body that starts in your mouth. Now, some of the other things that I'd like to talk about is how to prevent decay. Because decay is the other major issue that we're going to talk about with oral hygiene. And decay is a cavity. Okay? All cavities are caused by acid. And there's several forms of acid, or several ways that you can end up with acid in your mouth. First of all, it could be your diet. So lots of acidic foods or drinks. Cokes, soft drinks are very, very acidic. Sports drinks. Most people don't think sports drinks are bad for them, but they're very, very acidic. Powerades, Gatorades, those types of things. Citrus fruits, those are high in acid. So if you see folks that, there's some, believe it or not, some people have habits of sucking on lemons or chewing on lemons, or drink sports drinks all day. You're going to see more cavities in those people. Folks that drink Cokes, soft drinks all day long, those are going to result in cavities. Now, it's perfectly fine to drink one of those sports drinks or one of those Cokes at a meal or right after working out or exercising. But drinking them all day long, continually bathing your teeth in those acids, is where you're going to start to see problems. So some other ways that we see acid in the mouth that causes cavities. We all have bacteria in our mouth. Doesn't mean you're dirty, it just means you're human. All humans have bacteria in their mouth. Now that bacteria, those germs, they feed off the food that's in our mouth that gets left behind. And when they feed, the byproduct of them eating the food in our mouth is acidic. Okay? So the germs, the bacteria, the plaque in your mouth feeds off the foods in our mouth, the little pieces of food and drinks that we eat and drink, and creates acid that way. Now the third way that we end up with acid in our mouth has to do with our physiology. And that's a big word to mean our body chemistry. Some people's body chemistry is more acidic than others. Okay? Certainly if you have acid reflux or heartburn, that's when that really strong hydrochloric acid in your tummy gets regurgitated into your throat and into your mouth. And we see folks that have acid reflux problems or digestion problems or indigestion problems end up with more decay. So we at my office have a pretty neat way of diagnosing that and treating that and working with a GI physician to help curtail your acidic levels in your system. Okay? So we all have this acid in our mouths and in our bodies. So what do you do about it? Well, first thing I want you to do is brush your teeth as soon as you wake up in the morning. Now my wife was brushing and flossing like a good dentist wife, and she kept having cavities. So what we figured out is that she was going to the kitchen and she was making her coffee with sugar and milk every morning before she brushed her teeth. She'd enjoy her cup of coffee and then she'd go brush her teeth. And that's the wrong way to do things. You see, when you sleep at night, your mouth dries out. And our spit in our mouth, our saliva, is our body's #1 way to fight tooth decay. So when you have dry mouth, your immune system's not working to fight decay like it should be. So when you wake up in the morning with that cotton mouth, the very first thing I want you to do is brush your teeth and get all those germs off your teeth before you go have your morning cup of coffee or your breakfast. Okay? So very first thing you're going to do is brush. And the very last thing you're going to do during the day is brush. Once you brush your teeth at night, I don't want anything else to go in your mouth, alright? Except some water. Okay? So you're going to brush twice a day, and you're going to floss at least once a day. That's going to help reduce the plaque and the food in your mouth that leads to tooth decay. Alright? Now I do have patients that it doesn't matter how hard they try, they're brushing and they're flossing all day long. They say, "Doc, I brush 6 times a day and I floss after every meal, and every time I come and see you, I have another cavity." And so sometimes there are people like that, and they need a little extra help. So we always encourage folks to take advantage of fluoride. Fluoride is the best thing since sliced bread. You know that tooth decay was actually the #1 cause of death at one point in this world's history? Now fluoride is the #1 thing that we have done to help curb tooth decay. There's fluoride in just about every single type of toothpaste that you can buy now, and that's very important. Some people need even more fluoride on their teeth. And so we paint fluoride on their teeth here in the office. We have prescription toothpaste that has even more fluoride in it. And we can even make very comfortable rubber trays that go on your teeth. They look like Invisalign trays, the clear braces. It's not a big deal. They're very comfortable. They're not very noticeable. And you can wear those. You can put some toothpaste inside those trays and put them on your teeth and leave it there for 10-15 minutes. or if you're really good, even overnight. And keeping that high fluoride content on your teeth is really, really, really going to help reduce decay. So I'd like to talk to you about fluoride for a minute. So who is a high-risk patient and who needs more fluoride? Well, high-risk patients are categorized by the American Dental Association as anybody that's had a cavity in the past 2 years, anybody that's had a crown, anybody that's on a prescription medication. Believe it or not, the number one side effect of most medications out there is dry mouth. And remember I told you if the spit in your mouth isn't plentiful, then your immune system isn't working inside your mouth to prevent decay like it's supposed to. So anybody that's on a prescription medication is considered high risk for dental decay. We want you using fluoride also. Okay? People that have had cavities, have crowns, people that have gum recession. Okay, that's a big one. We start to see that quite a bit in our older patients. You see, there's several layers to our teeth. You have the enamel. That's the pretty white part of our teeth that people are used to seeing. That's the hardest substance in our body, and it's built to resist tooth decay. But there's a second layer that lives underneath your gums. That's called the cementum, and it's not supposed to be exposed. What we see in many patients, for a variety of reasons, is that they have gum recession. And when that second layer of your tooth gets exposed, it's more susceptible to decay, and that certainly puts you at a higher risk for tooth decay. We call that root surface decay. So if you've had gum recession, if you're on a prescription medication, if you've had a cavity in the past couple years, if you've had any major dental work done like a crown, you're all high risk patients. Now, that's not the end of the world. That just means we want to be more proactive with you, and we want to try harder to prevent further cavities. And what we're going to do is we're going to put you on prescription toothpaste. We're going to apply fluoride varnishes at your regular cleanings, and if we need to, we'll even make those comfortable fluoride trays that I talked about. We want to make sure everybody's getting their teeth cleaned twice a year. Get your annual x-rays. Most dentists now have digital x-rays. And even 20 digital x-rays is very, very low in radiation. It's like spending a day outside doing yard work. So don't be worried about your x-rays. Please get your x-rays. And if y'all have any questions, please don't hesitate to call the office. Area code 318-869-2593. I hope I've taught you something today. If you have any more questions, call us. I look forward to meeting y'all out there. If you have any problems or issues that you'd like me to talk to you about, I'd be happy to. Everybody have an awesome Monday. Enjoy this beautiful weather and have a great day. Bye-bye.